get some help? My dad, he's having a hard time breathing. Somebody. Oh my gosh. I'll get a wheelchair. Okay, Dad. Okay, I'm gonna put you on the blood pressure.
I can't breathe.
Okay, give me your arm. Okay, I'm gonna get you on some oxygen. Yeah, okay. Is there a doctor? He can't breathe. The doctor should be here soon.
Is the doctor in it?
Yes. My dad.
I guess so. How are you guys related?
This is my dad.
Okay. What have you heard so far?
Just that he can't breathe. We don't know much else.
He's pale. He is cold. Sir, what's your name? Are you having any pain? Okay. We have, what are his vitals? 140, 85, 84, 50, 49. Let's put the head of the bed down here a little bit. Okay. Does that help at all? No? Have you ever felt this way before? Listen here.
Getting worse. Do you know anything else? No,
So slow your breathing down so I can hear your heart.
He sees a kidney doctor. Okay.
Come on, cooperate.
No, my sister does
Neck
though.
things are all.
Let me go call my
over the
sister.
place.
Okay.
You're gonna.
She's gonna go find out who his kidney doctor is. He's seeing
Okay.
a kidney doctor.
All right.
That's
All
what she
right.
knows.
All right. His vital signs aren't getting any better. Why don't we get respiratory in here? Let's get
Okay.
some lines started. Why don't you get the rest of the team
Got
in
it.
and bring the code card?
Okay.
This does not look good. Okay, respiratory right away as soon as you can. Let's get him on. Start bagging him. I've got to say he's probably just fluid overloaded and congestive heart failure. We need some Lasix. We need. Can't put nitro paste on him. I got to unload this guy. I'm losing the pulse here. Sir, are you with us? Sir, give me a. Let's start bagging him. Where's the?
Guys here.
Start bagging him. Take this off. Let's get him. Start bagging him. Let's get him on. Get the pads on. Get ready to. And where's the rest of the staff?
I don't know.
Come on.
We need some help in here.
Any lines yet?
No, I haven't been able to find a vein.
All right. Let me try and get something in his neck.
Okay.
Plenty of big veins here. But somebody's got to start CPR for God's sakes. Where's the rest of the team?
I don't know.
There is no pulse. All right, I'll get some good compressions. He's got a really narrow pulse pressure, 190. He's in VTAC. He's in VTAC. I've got no pulse. And I've got no pulse right now. I need help in here. I need at least 2 more people. We need guys in a code. Get X-ray in here. Got respiratory. I need a nurse for meds. Okay. Do you have a stool? Is there any stool in here for the compressions?
No.
I'll tell you what. You got to really compress. Compress. There you go. Okay. Staying alive. Dun, 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 dun. There you go. Okay. Okay. We knew he's cardiac. He's in VFib arrest right now. Let's get ready to shock him. He needs to be on the pads.
Okay.
Where are the pads? We should have put that on right away.
I don't know.
You have no idea where the pads are?
I don't.
Cords through.
Where's the? I need a. God, I don't even have something to blow up the endotracheal tube balloon with.
Back here on the compressions. This just isn't happening. We need her to pull drugs. I want some calcium chloride. I want 1 milligram of that right now. And then I want bicarb. And give me a dose of epi. Epi first, calcium chloride, then bicarb. Renal patient, he's probably hyperkalemic. But why he coded and why he had that pressure, I still don't know. Okay, this has been going on now for 15 minutes, is that it? How long?
About 15.
Hold your compressions. We just failed here. He's got nothing. He's now asystolic. Guys, any thoughts? Let's call it.
Okay.
Hello. Hi. Come on in. I am so sorry.
Oh my God.
Your dad died. Oh, he had, I think he had, we just couldn't breathe for him. Between his breathing and his blood pressure, his heart stopped. It couldn't work. We tried medications. We tried breathing for him, but we couldn't get him back. I am so sorry. So sorry.
What happened?
Fluid that was accumulating in his body just took over, and I'm sorry we weren't able to turn things around. Do you have other family members here? Do you have anybody that's coming in? Do you want me to call a chaplain? Just, we're going to stay here with you. The nurse will be with you. If you want to be with your dad for a while, as long as you need to be here, let you be with him. I'm sorry. We just did all we could with medications, with trying to breathe for him, with trying to get the fluid. We just didn't succeed. I'm so sorry.
Okay, so we're gonna get you hooked up. Blood pressure. Yep, gonna get that taken care of. Absolutely. Okay.
Is this the patient that needs some help?
Yes.
He is really short. Hold on. Hey, I said you get some history here. I looked to see if he was in the hospital records, but he's never been here before.
Okay.
Sir, what's going on? Can you tell me what's wrong? Any chest pain? How are you guys related?
This is my dad.
Okay. And when did he start to get sick?
Late last night, he started being short of breath and he couldn't lay down flat.
Any family members? Do you know who his doctor is?
No, but my sister does.
Okay, I'll tell you what. Go get some more information from us. Find out who the doctor is and what medications he's on and if he's allergic to anything.
Okay.
Okay? It's going to be important. Sir, we've got some oxygen on you right now. Your blood pressure is really, it's low. Your heart rate's fast. Let me see what's going on here. This has happened really quick. Just trying to get a look to see what's causing all this. Here, good sliding, no pneumo. Here, again, good sliding, no pneumo. Just take a quick look. Heart. You have a lot of fluid around your heart, sir. It's called a pericardial effusion. And his pressure is only 81. We're going to need IVs on him.
IVs on him?
I need 2 large bore IVs, and I want to get 2 liters of fluid into him as soon as possible.
Okay.
I'm going to need help here. Teresa's working today. Can you
Yes.
get Dr. Wu?
Yeah.
Okay. All right. If you start to get any chest pain, you let us know. Okay. We're going to get the nurses getting this the line started.
Okay.
All right.
Teresa,
Yeah. Come on in here. 50-ish-year-old gentleman. A day's worth, basically, of acute increasing shortness of breath. Take a look. He's got a huge pericardial effusion. No pneumothorax that we can see on either side. Agree?
Hi, sir. I'm Dr. Wu. Nice to meet you. I'm working with Dr. Barron today. Okay. Yes, I
Okay.
concur.
So we're gonna need, I think if this came on fast enough, he's hypotensive, pressure is in the 80s, tachycardic at 140, we gotta get that fluid off. I'd like you to help me out with pericardial centesis. I'll manage the airway and or sedation.
Sure. Sounds good.
Okay,
Breathing your chest here, okay? We're going to go ahead and take that fluid off of your heart. great. I got a bunch of blood back. I'm pulling back really easily, and I can see my needle on ultrasound in the pericardial sac. Okay, good. Looks like the RV is starting to come back up. I'm getting all that fluid off of his pericardial space. Huh. Okay, yeah, the heart's contracting well. The pericardial sac has been evacuated.
Right, and his O2 sats are now starting to drop. They came back up, and now they're dropping again. Possibility of some barotrauma here, you think?
So weird. I didn't hit his pericardium or anything.
Do we need to bring X-ray in here to do an X-ray of his chest to see if we've got a pneumo?
Oh, wait, you know what? Let me just put this needle down and just take a look. Yeah, let me just look at ultrasound. Okay, let me take a peek. Let me look on this side first, because that's where I was in. Okay. No. Good lung sliding. Okay, good. Good lung point. Come over here. Oh, you know what? I think he's getting a tension pneumo. Let's turn off the vent for a second. We probably need to go ahead and decompress that.
Space go over the rib and down, and we have air. Okay, that's in. We still got some air moving.
Let's go ahead and hook him back on the
back
vent.
up on the vent. Let's turn it back on.
Blood pressure's going up. Heart rate's coming down. His sats are coming up. Awesome. Good catch.
Right. A lot of things have gone on with your dad. We were able to get the fluid off of his heart. All the fluid that was compressing his heart and not allowing it to expand has now been taken away. We had to put him on the ventilator to be able to sedate him enough to do that procedure. Unfortunately, although things went really well with that, once we had him on the ventilator, things started to go bad, and we then found out that a hole had been ruptured in his lung called a pneumothorax. And we were able to pick that up right away. He's got another tube on the other side of his chest, draining air from that chest. But right now, he's stable, okay? Although it sounds terrible, but the hole in his lung will heal up on its own. We've got a cardiologist involved, and his kidney doctor is involved. We'll figure out why that fluid accumulated and do whatever needs to be done to make sure that it doesn't accumulate again, okay? With that point, do you have any questions up to now?
No, just thank you so much.
Again, what you saw how struggling he was to begin with. Right now he's comfortable, his heart rate's come down, his blood pressure has come up. He's really doing a lot better. He's really doing a lot better.
Okay. Thank you. Thank you so much.
You're very welcome. You're very welcome. He's gonna do great.
Okay.
We'll get him back home soon.
Okay.